Well, welcome to another webinar of the Telehealth Echo Project series. These events are brought to you by the American Academy of Pediatrics, California, Chapter 2, in collaboration with the San Bernardino County Medical Society and the California Medical Association. The Telehealth Project is made possible by a grant from the American Academy of Pediatrics, the national organization. Thank you, everyone, for participating. I would like to make sure that everyone puts in their name in the chat, because this is how we keep attendance for CME and ultimately for MOC Part 2 credit if you are also going for that. The sessions are designed to last 60 minutes maximum. The round pie chart on the right shows that we begin with a welcome and introductions. We do skip the intro just to save time. Then we have a didactic portion for about 20-25 minutes with Q&A. After that, we have a case presentation and discussion. And we end with more questions if anybody has questions from both the case or the didactic portion. On the left side of the slide, I have the calendar for all of the events. So today is February 18th. We're talking about telehealth platforms. And then we have on March 4th is going to be preventive care. March 18th, social and cultural considerations. And lastly, on the 1st of April, we will have telehealth after COVID-19. So we have the honor today of having Mitzi Young. She's going to cover telehealth platforms. Mitzi is a physician advocate with the California Medical Association. She brings 25 years experience in the healthcare industry, specifically in the management of business operations. Thank you very much, Mitzi, for being with us. I'm going to stop sharing my screen so that you can share yours.
Thank you. Okay, can you guys see this okay?
Yes.
Okay, I need to, hold on a second. I want to make sure that you guys can see it the way that I want you to see it. For some reason,
I think I do see your slides on your notes on the left, or the little slides.
yeah, I don't want it to be like that. Yeah. So I'm gonna.
You know what some people do? Go to the slideshow and present from the beginning.
Or you can just click that little icon in the top with it shows like a computer screen. No, two more over to the right with a arrow in the middle of it.
Yeah, mine is, for whatever reason, I've got a tab bar here, so I'm having a little bit of problem getting to those tabs.
Yeah, but
okay, hold on. Here we go. Here we go. So slideshow, and then I'm going to just do this from the beginning.
Yeah, from the beginning.
Can you guys see that okay now?
That did it.
Good.
Nice and big. Yeah. Yes. All right, great, perfect. Well, thank you everyone for inviting me today. I'm actually going to be standing in for David Ford, which is the Vice President of IT Services for the California Medical Association. My name is Mitzi Young. I'm the Assistant Director of Practice Strategies for the California Medical Association. That title actually just changed last week from Physician Advocate. So I am going to run through these slides pretty quickly, and then we'll have a little bit of time for our Q&A. So first off, I've always got to just kind of give the important disclaimer that I just need to let you know that nothing I'm about to say is legal advice. The presentation is intended to be informational only. Okay, so let's get started here. So here to start off things, I just want to share a few thoughts about the presentation today. As CMA has presented about telehealth over the past year, help with selecting the right product has been the #2 request that we have gotten after help with billing and reimbursement. So some doctors go as far as asking us, what should I buy? We can't really answer that question. There's a lot of variables to consider, and CMA doesn't endorse any one platform. So it's going to be very specific to your practice, certainly, that we can talk one-on-one about that if you'd like at another time. But what we can do is we can help to think about how to approach selecting the platform that is right for you. So let's just get right into it. So let's talk about telehealth technology. Falls into 3 different buckets. The good old-fashioned telephone, which we sometimes call voice only or audio only. Commercial available technology like Skype and FaceTime and Zoom. And dedicated health platforms like DoxyMe and Medici. And I want to talk a little bit about the pros and cons of each of them. So first, let's talk about the telephone. The obvious pros of a telephone is that it's usually the most accessible technology for your patients. Even if you're treating underserved populations who may not have home internet service or smart devices, they most certainly probably have a phone. The main con is that not all payers will pay for telephone visits. So right now, during the COVID-19 pandemic, Medi-Cal managed care plans and commercial plans in California have been directed by their regulators to pay phone visits at the same rate as an in-person visit. But there are debates going on in the legislature right now about whether that will continue. So if you have any questions about this, please just reach out to me and we can go over that. So at the beginning of the pandemic, the federal government issued a waiver allowing physicians to use commercial software like the basic versions of Skype or Zoom or FaceTime. Since we all live our lives on Zoom right now, it seems like, these are always also very accessible to the patients. They probably already use them for distance learning or remote working from home. But there's a big but with these technologies. When the public health emergency finally ends, most people believe that the federal government will not continue the waiver that allows non-HIPAA compliant technology to be used. So if you're using one of these, you want to be looking now for what the next platform will be. So Skype and Zoom and Google Meetings all have HIPAA compliant versions, just so you know, that you can actually pay for. And so you want to really talk about that. And we're going to talk about the basics of these right now, the free versions, if you will. So finally, there's the true telehealth platform that falls into 2 types. There are standalone programs and apps like DoxyMe, Medici, UpDocs, or Zoom Health. The other type is embedded platforms that are bundled with the EHR like Athena Health or Epic. So like everything else, there's a good and bad to each of these types of telehealth platforms. So let's go. A standalone system might be easier to get up and running. Most of them are either web-based or smartphone apps, which patients are usually pretty used to. On the other hand, an embedded system will work seamlessly with your EHR, eliminating any data hassles and making documentation much, much easier. There are also standalone platforms that integrate with an EHR, and we'll talk a little bit more about those in the next few slides. So a good place to start is looking at the company behind the technology. So telehealth is hot right now, and there's a lot of startup type companies moving into the market. And while these companies might have great technology, many of them won't make it. And we've seen that throughout the years with EHR and practice management systems. So, you want to make sure that they will be able to be viable for you long term. So a lot of them will actually be sold to larger companies, and then they can leave a practice in a lurch. So ask some questions about the company's history and the business model. It can save you a lot of headaches down the line. And these are kind of, some key considerations to think about when asking the questions. So if you are not using a telehealth system embedded in your EHR, it can be very beneficial to use one that integrates with your system. It allows you to stay in the EHR environment while you're having a telehealth visit, bonus. That makes it much easier to document while you're speaking with the patient. Data reporting and claim submissions are much easier with an integrated system. If you are considering a telehealth platform, it is good to ask both the telehealth company and your EHR if they can integrate. Integration problems can arise on either side, and either company may want to charge you fees for your integration. So you want to be really careful about those hidden fees, because I see that a lot with EHR integrations. It's also a really good idea before you decide on a platform to take it for a test drive as though you are the one of your staff or a patient. You want to understand the user experience of the platform. So it's really good to kind of look at yourself on the other side of the fence, if you will. For example, is the software easy to download and use? Does it require the patient to create an account? Will it work with all devices? You want to have the answers to all of these questions. If your staff and your patients don't like the system, they won't use it. And we find most of the time right now, even if they do like the system, they're probably only using about 20% of its capacity. So you will waste a lot of time and money on something that won't even benefit your practice. So selecting a platform. Here's what you need to know. Because someone asks me this a lot anyway. Medici integrates with Allscripts, Athena, CareCloud, Dr. Chrono, and Cario. So obviously cost is a consideration. The prices on this screen were pulled from the website for some of the... Can you guys hear me? Sorry. The prices on the screen were pulled from a website of some of the top telehealth platforms for small practices. They are just intended to give you a range. I cannot confirm what their pricing would be for your practice. I really want you to pay attention to user versus month. And then there's device compatibility. What device are you planning to use, and what device do you expect your patients to be using? For example, some platforms are web-based, meaning the patients just need a laptop to use them. Others are app-based and require both you and the patients to have a smartphone or a tablet. And among the apps, some of them work only with Apple or Android. If you pick one of those because you have, for example, an iPhone, you might not be able to connect with patients who have an Android phone. So you have to be cognizant of that. So finally, for any technology you purchase, you want to ask about customer support. This is really, really important. Once you have a system in your practice, you want to make sure that you're going to have that kind of level of support that you need from the company. This is important both for implementation and ongoing issues. And is that something that you're going to have to pay a monthly fee for? How much more is it per year? Those kinds of things are going to be really important to ask. One really important question to ask is whether their customer support hours are. A lot of times what happens is that, for example, we see that a customer support is in Florida and their hours are 8 to 5, and that would be 5 a.m. to 2 p.m. for us here on the West Coast. So ask about after hours and weekend support. We all know there's nothing worse than having practice stalled because of malfunctioning technology. It is the worst. And it makes for really angry doctors, so we don't want that either. HIPAA compliant solutions. I think that on this slide and the next one, I've assembled some basic information from the websites of some of the biggest platforms. I'm not going to go through them one by one, but when you get these slides after the call, you can read them for yourself. And if you have any questions, please just feel free to email me. So I'm not going to go through those. Some CMA telehealth resources. I just want to end by putting in a plug for a brand new CMA resource that has recently launched online, our Telehealth Resource Center. CMA scoured the web for the best of the best in telehealth resources. We organize them by topic and publish them on our website. It should have some resources for almost any question you might have, so make sure that you give it a look. And here's the website. And I'm going to open it now for any questions that I might be able to answer, or if I can't, I will find the answers for you.
Mitzi, this is Rajashekar. Can you please project the different platforms that are available now? You just showed that maybe the last slide or the one before.
Yeah, let me go back and take a look at that for you.
Those are the HIPAA compliant sites, correct?
Yep. So these are going to be these ones right here. Hold on one second. I'm going to just look at it and then we'll go through. So I think it's really important that you take a look and make sure that these telehealth platforms are integrated into your EHR. That's going to be the most important thing. Ask all the questions that you possibly can ask about that. One of the things that you want to make sure that they can do, and I've seen this happen just recently, they've had and they didn't integrate that well. So what they said is, well, we're going to start from here, go forward, and you can keep your other platform on for, 3 to 6 months. We just really don't want that happening. That is a nightmare for a practice. So we want to make sure that integration is something that they can do for you and that they can get everything, loaded over with your EHR.
So the Zoom Health is a special product by the Zoom?
That's correct. Yes. So Zoom Health is something that a provider would actually pay for, and it's HIPAA compliant. Most everybody is using the free Zoom right now, and that's okay during the pandemic because they've given waivers for that. But once the pandemic is over, we know that those kinds of things are not going to be HIPAA compliant. So you're going to want to look into Zoom Health is excellent. Actually, I really like it.
How long it has been there, Zoom Health?
Let's see. I don't have the exact date, but I want to say that it's been a couple of years. But I can let you know for sure, Dr. Rajashekar. I'll give you the exact. Any other questions?
Is it one screen or two screens you have on this?
There we go. I'm going to just, I'm going to send that over there. And it'd be really, really great. Like I said, it was on a EHR committee for CMA. I was part of that committee that we had done a lot of work on EHR. So you want to make sure that you go over to that website and go into our tools that we have built for you. And that will also help to give you guys some information on what you should be looking for and what you should be asking.
Okay.
And of course, we're always here to answer any questions you have.
Thank you.
You're very welcome. Tomas, do you have any other questions anywhere?
Let me see if there's anything else in the chat.
There is a platform that I was talking about last time. It's called Dialer. I don't know if it's a HIPAA compliant. It's available through Doximity app.
I don't think that would be a free one. It's part of Doximity, right?
Yes, it's free for members of Doximity.
Oh, okay. So it's something that you're going to have to pay for on that side then for your membership, I suppose.
Yes.
Right. So I think that, again, if you're using Doximity, which a lot are using the free Doximity, it would be really helpful to look into that and see what how that will work for you or integrate. Again, integration is important. If you're not using patient portals, things like that, I mean, these are just really super great tools to really get things more efficient between the communication of you and your patients. And lucky for you, being pediatricians, you're probably working with a demographic of folks that are really computer literate. Well, if you guys have any additional questions, please feel free to give me a call or email me. I'd be glad to help you one-on-one. I'm going to sign off of this right now because I have another meeting to do, unless you have any other questions. Okay, I'm going to leave the meeting. Thank you so much, everybody. Appreciate the invite today.
Thank you, Mitzi. Thank you so much. So I will proceed to share our PowerPoint again. Okay, so the slide that should be on the screen now is the case presentation and discussion. Do you see that? Okay, so as part of our dynamic for this session is the discussion of a case, and today's case is presented by Dr. Marcelino Kalimlim. I have the slide on the screen. Dr. Kalimlim, if you can tell us about your case.
So I think this was a week ago. I have a 2-year-old patient who the mother called in because the child has cough, myalgia, and is positive for COVID. So the platform that we use is through voice, which is telephone. I don't have a video telehealth platform in the office. So I spoke to the mother and got all the information, very straightforward. The patient has a cough for 2-3 days and a low-grade fever of 100 degrees Fahrenheit. The vitals are okay. The respiration is about 30s, I believe, and the heart rate is about 106. The patient's whole family is infected with COVID. Nobody is in the hospital. Patient's vitals are stable. And so I use a telehealth to communicate with them and ask different questions about the patient. And the mother is Spanish speaking only, but I was able to communicate through with my little knowledge in Spanish. And so I was able to give her the plan, what we do, what we should do for that matter. And so I said, mainly this is a supportive care. And at the same time, I ordered a chest x-ray because the patient is coughing and positive for COVID and all that. So I ordered a chest x-ray online. I finished the charting online, and then I told her that I might need to call her back using the dialer, which is, like I said, through Doximity, which is a free platform. If you are a member of Doximity.com, I think these are mostly doctors. So I tried to do that, but they didn't accept the call. I was able to complete the visit through the telephone and able to send the request for the chest x-ray. And then the mom actually came and took the requisition and did a chest x-ray, and the chest x-ray was negative. So I think even though I was not able to try the dialer through Doximity, I was able to satisfy and complete the visit through the voice telehealth with the mother, with the patient. So my point actually with this is that in any form of or platform of a telehealth that you use, the most important thing is the communication is effective on both sides, meaning they understood you and you understand that, aside from gathering all the information you need.
This is Rajashekar. Hi, Mark.
Hello.
Thanks for that presentation. In addition to communication, the time that you spend and the advice you give and all those things got to be counted for the payment. As of today, telephone communication as well as using anything that is non-HIPAA compliant, all those things are getting paid. But going forward, when they require HIPAA compliance, and in case they don't allow telephone interviews and things like that, they want a video call. We don't know at this time what the future is going to be. That is the reason why we thought we will have this presentation today, so that we'll be more knowledgeable about what to look for in the future. So as of today, communication through telephone mostly is fine. But going forward, if they say, no, we are not going to pay for telephone advice, and you spend like 20 minutes, I think that is not fair for the physicians. And today we are doing different platforms, but so many of them are not HIPAA compliant. And tomorrow, if they say HIPAA compliance is a must, then we don't want to get stuck not knowing where we stand. So at least we have a knowledge about what is available in the market. At least we can pay attention to that. See, everybody uses Zoom. I did not know something called Zoom Health, which is a HIPAA compliant platform. I'll have to look into the details of that. So I'm just giving that as an example. So learning about different platforms available and which are HIPAA compliant and all that kind of things, I think it is better to have that knowledge. That's all I wanted to say at this time. I'm sure Dr. Emoto, Dr. Arteaga will have some comments. And also Dr. Valencia.
Hi, this is Dr. Valencia, Dr. Rajasekar. We use Doxy.me, but that we actually pay every month. There's a fee for that, and that's actually compliant. And it actually also interacts with our EHR. So we're actually really happy. We don't have any problems, easy to use. Even the parents are actually finding it really, easy for them. Most of the time, they usually would use their telephones. And so I do the televideo with them, and sometimes they're in their car, sometimes they're outside their homes, but it's very effective. So, just for everyone to know, if you guys are, thinking about the HIPAA compliant one.
Dr. Valencia, looks like you are ahead of the game.
Oh, thank you.
That's good to know.
My
that.
office manager is, I'm not tech savvy, but I can learn. But I learned really easy because I practically do just telehealth from home the whole day.
That's her advantage.
If you don't mind, do you mind sharing how much you pay monthly?
I think for 4 providers, we're paying $150 a month. So it's actually not bad because there's 4 providers, and the providers that see the patients in person, then they actually do the first hour, like 8 o'clock. Usually patients are late. So 8 o'clock and the end of the day, 4:30 is when they do the telehealth. So that way, while the MAs are still rooming the patients in, then they don't lose the time. They're already able to see 2 patients like via telehealth. And then I do the telehealth the whole day at home.
2 more questions, can I ask you?
Sure.
When you chose this platform, how did you install it? Did they help you to install it, or your manager did everything? Yeah, go ahead, answer that question, then I'll go to the second. Did you hear what I said? Oh, looks like we lost Dr. Anishi.
So we have a question in the chat. We have 2 questions, but I want to ask this last one first. How does it integrate into the EHR is the question.
Basically, you open the program through the EHR. That's how I was told, because eClinicalWorks is the electronic medical record that I use, and they have a platform for telehealth. So they said we got to go through the EHR first, and that will take us to the telehealth platform. And maybe somebody else has a different information, I don't know.
So Dr. Rajasekar, this is Cheryl Emoto. We also use eClinical, and I have been the platform within eClinical. And my biggest issue is the patients having trouble with the technology. They have to download something first, and we're still trying. We're still working with it, but we haven't had great success yet.
So you're using a eClinicalWorks platform to do the telehealth at this time?
It's a Hilo.
Yes.
Hilo.
Hilo, yeah.
Yes.
And
And Hilo is a you pay per visit.
correct. But patients having difficulty with what?
My patients are having difficulty either connecting all together, and then we just kind of give up and go back to phone.
Oh,
Or the other part is we're able to connect, but all I can see is a little tiny picture, and I can confirm life, but that's about it. It's not really much of an exam. But when we test it out with my staff, we get a nice, good picture. And so I don't know if it's the phones or what the issue is.
did you ask eClinicalWorks about this?
I don't believe we have yet.
Yeah, once we call them, they sometimes will come up with some things that maybe we need to fix. Because unless we tell them, they won't be able to fix it.
That's true.
Yeah.
Yeah, we're trying to give it a little more trial yet here.
Yeah.
So when Dr. Kalimlim was finishing his presentation about the telephone visit with a patient, we had a comment in the chat box from Dr. Copa. Dr. Copa says that payments currently are much lower for telephone calls than video calls. The video calls are paid at the same rate as regular visits, whereas the telephone call are paid at a fraction of that, sometimes $20 or less per visit. Has that been everyone's experience?
No, the reason is it depends on the code that you are using. You know, during the billing session that we had the previous time, you can bill 99213, 212, whatever the visit code, 214, if you are doing a lot of things. And when you use that visit code and put modifier 95, that is considered as a televisit. It doesn't tell the payer whether it's a telephone call or whether it's a video call.
Dr. Rajashekar, this is Dr. Murthy. For telephone call, you cannot bill 99213, you have to bill 99441.
Yeah,
That's what he said.
No, according to the present regulations, as far as I know, you don't need to say whether you are doing a telephone call or a video call. You just bill for the service depending on the ICD code, using the ICD code.
No, but last week, she said we cannot do that, no? She said for telephone, you have to do different, and video, you have to do different. Video is like same, but just 95 modifier.
Yeah, well, we're gonna have to get clarification on that, because Dr. Copa says that only video calls are billed with 99213. Dr. Kleiner says that she doesn't get paid for any phone calls at all unless they use a telemedicine code, never when they use a phone call code.
Is it the medical HMOs or is it a commercial HMOs? Which one we are talking about?
Commercial. Both Kleiner and Copa says commercial.
Well, the problem with the commercial is the usual problems. They don't want to pay for anything. And they'll find some excuse for not paying. But clearly, if you look at the guidelines from the state, the medical HMOs, they do pay for all these things. They consider telephone and video as the same. There is no difference. So with the commercial, we need to talk to the IPAs to educate them, and sometimes they can be deaf. They don't want to listen. They don't want to hear what they don't want to hear. That is definitely a problem. But according to regulation, they got to pay. We'll get more information on this maybe by next meeting.
Dr. Rajasekar, Dr. Valencia again. I lost you earlier because I lost connection. You
Yes,
had
Dr.
two more
Valencia.
questions, sorry.
Yeah. Did the company set up everything for you when you set it up, or only your manager had to do everything?
My manager had to do everything.
So
But he was talking to them and somehow set up where the Doxim is actually communicating with the EHR. So our EHR is Athena Health, and it's working really good. They do all the billing and they catch up all the telehealth that we do, and we get paid for them.
what is your experience with the previous question? When you do telephone call or whether you do a video call, are you getting paid same for both, or you're getting paid different?
Well, we don't do telephone calls anymore. We just convert them into televideo calls, so we get paid.
So everything is
Everything is
video.
televideo. Yes. So when we get phone calls throughout the day and we give advice, we turn that into telehealth, because anyway, you just add them on and it would only take 5-10 minutes to do the telephone call. So you're going to use the same amount of time, but at least we get paid.
Hmm.
Can I just say something? This is Allison. You know, this theme keeps coming up. In case those reimbursement waivers are discontinued entirely, it sounds like it's in everyone's best interest to find a way to create a system where you are using just video calls. Yeah, and the problem is that what Dr. Emoto and Dr. Kalimlim pointed out, that sometimes on the recipient side, the patients are not comfortable, you know, downloading something. And for instance, Dr. Kalimlim had to, the patient didn't accept the call. So he had to go back to using the telephone. So that's an issue. And when it comes to lobbying the government, the CMA, I know will be involved in prevailing upon them to extend those waivers, but it may or may not happen. So as much as possible, it sounds like it's best to transition to video.
And we find it easier to do televideo because we can see the parent and the patient in person. You know, it's harder to talk to the mom on the phone and you're not even seeing the patient at all. You know, at least we can do visual examination. And if the kid looks really sick, then we just give them an appointment for in person.
So you did not run into a problem like what Mark was presenting? Saying
No.
that,
Yeah.
Okay. Good to know that. And how is the service after hours by the vendor? Dr. Valencia.
The service after hours. My physician assistant is the one that takes all after hours call. So she also is set up at home to do the televideo. So she also does the televideo. She does the same thing.
Yeah, if there is any technical difficulty, is somebody available to fix that problem after hours?
Yes, the office manager is available 24 hours. It's my son, so he's available 24 hours.
But what I'm asking is, you are using that particular product. Which one you said, Doxy?
Oh, the Doxy.me, the Doxy.me.
Are they available after 5 o'clock?
Yeah, he is able to contact them.
Oh, okay.
Yes.
That's good to know that.
Yes.
So it looks like Dr. Valencia has a very good experience at this time using a HIPAA compliant program, and it's very educational because I have not come across someone else in my area who is using a HIPAA compliant program.
I know that a couple of people in the high desert use Medici, which Mitzi mentioned, and they've been pretty happy with it too.
Oh, okay.
Medici.
And I think Athena is good too, and the CMA has experience with Athena. So if you had problems with them, that's another avenue of outreach. You could always come through CMA or us for help on Athena.
Yes, this is Dr. Valencia again. And yeah, we really find Athena. I mean, we used to have e-clinicals and we were having a lot of problems with e-clinical. And so we switched to, remember I told you, Dr. Rajaseka, we're switching to Athena and we're really happy. They're, you know, Athena catches everything, we get paid and they do all the billing and we don't even have any issues at all. Yeah, and they're available also 24 hours a day, you know, if you need to talk to them.
Tomas, for you.
I do not have any more questions in the chat. We can finish early. We made this session very efficient. Does anybody else who's still on the call have any comments on what their preferences are? Anybody who has not spoken yet, on what your preferences are with any platform for telehealth, or if you have a platform that you're currently using that you really like, that you would like to talk about?
I can comment. I can't say that I like it. This is Dr. Kleiner from Sherman Oaks, Alone and Pioneer. We use Doxy.me. I don't think it's that great, to be honest with you. I think the resolution is kind of poor on the video sometimes, especially if it's rashes. We have a couple of our providers who are using the paid version because we're not doing it for the entire practice. The paid version is $35 per provider if you do it per month, if you do it per provider. I did not find that the paid version was any better than the free version. We sometimes do have issues with connectivity. I do think it's more the program because our patients tend to have good service, good cameras, good internet or Wi-Fi, whatever it is that they're using. It depends on time of day, I believe. So I don't know how that works with Doxy.me. Our current EHR is PCC, and we can directly access Doxy.me through PCC. It's through our website, so the patients don't have to download anything. They connect through it and have the password. But I was asking about when you guys say it's integrated, I wasn't sure what that meant, if it's somehow other information gets put into the EHR or billing or anything of that sort. Ours does not. We do our video as if we were going to do a note, and I mean a visit, and then we type everything up into our EHR and bill for it as we would a normal visit. That's it.
These slides that Mitzi presented, giving the different platforms that are available which are HIPAA compliant, is it something that you can send to everyone, Tomas?
Yes, absolutely. I can do that.
Thank you. And also we need to get some clarification on whether we can use the regular office visit codes on telehealth, both for the video as well as telephone calls. As far as I know, it is allowed as of today because of the COVID. Telephone calls and video calls are considered as same. We need to get that clarification and send an email to all the participants.
Dr. Roger, I'm of the same belief as you. We're billing regular office visit calls for our managed Medi-Cal patients. I guess all of our Medi-Cal patients.
Yes. Yeah.
So
We'll nothing wrong in asking the same question again to get, to make sure that we are doing the right thing. Yeah.
yeah.
So we'll get that clarification and send an email.
Yeah, absolutely. I will reach out to our previous speakers as well to get their input, since the first two presentations also touched on particular codes that we can use.
I think, yeah, if you want to make a list of those, I'll be happy to help you, Tomas. David Ford at the CMA can help address those.
Yeah. All right. Well, that's it. Thank you so much for participating today. Keep looking at your calendar, because we have the March 4th is going to be the next session in about in 2 weeks exactly. That's going to be telehealth for preventive care. So I hope everyone has a wonderful day today, and thank you for joining us.